This is a 25-year-old female who had a road traffic accident one day ago and sustained this closed fracture of the mid tibia, as you can well appreciate in these x-rays. So we have three pictures before us. On the left is the AP view, in the middle is the knee joint, and on the right is the lateral view of the tibia and the fibula. So remember, in the leg as well, okay, the lower limb has three parts. That's the thigh, the leg, and the foot. Then in the leg we have two bones, the tibia and the fibula. The tibia is the biggest, or is the bigger one, and the fibula is the smaller one. That's how you can differentiate them. At least that one is easier. So it is mid tibia because when you divide the shaft into 3/3, you try to approximate that fracture line is within the mid third. Then someone may ask themselves the reason as to why we included the knee and the ankle joints. Remember, these are the joints that are adjacent to the bone that got fractured. So we shall need to include them as we are requesting for the x-ray, because we don't want to miss out any injury that could encroach on the articular surface. Remember, these injuries that encroach on the articular surface are a little more tricky compared to even these other injuries. So we don't want to miss out anything as we are managing this patient. Then about the pattern, I would like you to comment in the comment section, which pattern do you think it could be? Because remember, we have the transverse, the oblique, the comminuted, the spiral, the segmented, etc., depending on the magnitude of the force and how this force is transmitted through the bone to cause the fracture. Then these are some of the pics taken during the process of cast application. So after reduction, we used a complete and split POP cast. This is when it was still complete, but later it was cut along its length, and then a crepe bandage is used to maintain its integrity so that it can function well. So complete and split, why? Because this is an injury where after reduction you will need to immobilize it so that you don't lose your reduction. So you prefer something that is going to almost take the whole circumference of the limb, but it is a fresh injury which needs to have an area of expansion so that it can accommodate the swelling and all those other features that come along with the inflammation in a fresh injury. So that's why we apply that complete, and then we split it and then maintain the bandage to maintain its integrity. So after a few days, when this inflammation has settled down, of course the limb tries to take its normal size, and the cast for it doesn't reduce in circumference, because it took the other original circumference of the swollen limb. So you'll have some bit of sagging within the cast. That's when you complete it, and again you prescribe the full treatment time for the patient. Thank you.